there's no range of motion there. Even though it's a synovial joint, its range of motion is really, really limited. Uniaxial means that it's, look at just the word uni, like a unicycle, right? One wheel. So it's only one directional movement, okay? Biaxial, that means it's going in two directions, okay? And then multiaxial, and my multiaxial would be something like this. Okay? Many different directions. On my radius to my ulna in anatomical position, tell me, what's on the lateral side of my forearm?
Radius.
The lateral side of my forearm, which bone?
Yeah.
The radius. Okay? So my ulna is fixed, right? It can only do this. Right? My radius can do this. Okay? So when I do something like that, that is a motion that you need to know. Our next unit is to tell us which muscles do that, but the action, when I do that, that's called pronation. When I do that, that's called supination. Okay? So how do I remember pronation versus supination? Okay, well, pronation, I'm looking at the back of my palm, back of my hand, right? Okay, that's a back prone. When you're laying prone, you're laying on your stomach. You're looking at the back is sticking up, okay? So then when I go like this, it's like, oh, I can hold soup. I know. I'm a molecular biologist. I got to figure out any which way. Okay. So, oh yeah. Prone, the back of my hand, like prone. And then when I do this, oh yeah, I can hold soup. So that's supination. That's pronation. Okay? All right? So we're going to go through some of these movements at the joints to have a little bit better description. I'm not asking you to learn these terms though. Uniaxial, non-axial. No, you don't need to know that. I do need you to know things such as the word glide. I don't even like gliding. I don't even like gliding. This is what I like. So in anatomical position, I'm standing upright. My hands are to my side, palms facing forward. Okay, so all my questions are in reference to that standard. So if I have flexion, I'm going to have flexion when I decrease the angle between bones. So when I do this, that's flexion of my forearm. When I bring it back down to anatomical position, the opposite is going to be extension. Flexion, extension. Okay? Now, I can also have flexion and extension at my shoulder, at my arm. Flexion, extension. Bringing it back to then anatomical position. But you know what? Can't you bring that arm back? That's called hyperextension. So decreasing the angle between two bones is called flexion. Bringing it back to and increasing the angle, extension. Flexion, extension. Notice the direction of the movement of the bones. In flexion and extension, it is perpendicular to the coronal plane. So I'm doing that. I'm doing that. It's perpendicular to the coronal plane. Okay? Now, can I flex and extend my head? Oh yeah. Okay, I can flex my head, right, by bringing this down. And what allows me to do that? It's my atlas. My atlas allows me to then flex my head. Okay? And then, when I bring it back to anatomical position, okay, it's in again. Now I'm looking straight ahead. But I can hyperextend, can't I? Sure, I can do that. Okay, so with my head at that joint, at the occipital condyles to the atlas, I can actually do flexion, extension, hyperextension. Okay, now, if I take that And I can do that with my thigh. Flexion, bring my thigh up. Extension, get it back to anatomical position. I can do it with my lower leg. Then, that's flexion of my lower leg at my knee, and then extend. Okay? I can flex, I can extend, I can hyperextend. Okay? Again, everything with flexion and extension is relative to, or perpendicular to the coronal plane. Now, I can also bring my arms out. When I bring my arms out and it's parallel to the coronal plane, I call that abduction and adduction. Okay? A, B. The B is facing away from the A, so it's away from the main axis of the body. That's abduction of my arm. When I bring it back together to anatomical position, that's called adduction. Okay, so the D, I'm adding it to now, closer to my body, to the main axis. Okay. Can I do that with my forearm? No. I can do it at my shoulder. I can do that with my arm. I cannot abduct and adduct my forearm or my antebrachium. I can abduct, adduct the brachium. Okay. Now, I can do the same thing at my hip. I can go ahead and bring my thigh out, and when I bring it out, that's called abduction. When I bring it back together, it's adduction. Okay, so abduction and adduction are parallel to my coronal plane. Now, can I do that with my lower leg? No. This part up here is called your thigh or your upper leg. Okay, the femoral region, and that. And then the lower portion, the lower leg is from the knee down to the ankle. Okay? So I can't do that with my lower leg. I can't do an abduction and an adduction at my lower leg, but I can here on my thigh. Okay, now, all right, so I've got to add, okay, so the next one, so flexion and extension. Okay, we understand that one. We then move to, I'm just going to go through, okay, rotation. So when I'm in rotation, that means that my supination and my pronation are rotation. My radius is rotating around my ulna. That's a rotation. Okay, can I rotate my thigh? Oh yeah, I can stand there and I can turn my thigh outward, can't I? And I can bring my thigh back in. So that's lateral rotation and bringing it back to anatomical position, medial rotation. Okay, can I rotate my lower leg? No, can't do that, but I can rotate my forearm. Can I rotate my brachium? Oh yeah, I'm in anatomical position. Can't I turn my arm? Rotate it? Can't I bring it back? Yeah. So I can rotate my arm. So that's what that is. It's movement around the long axis. I can even do, for example, when you're rotating and not nodding your head, but you're going no, that's a rotation. Okay. All right. So the next one, abduction, adduction. So we already know that. Okay. Now circumduction. Circumduction is when I can move everything all together. Abduction, adduction, flexion, extension. So when I am doing this, like the butterfly, okay, that's circumduction. I can do that with my hip too. I can do circumduction because I have then a head of a femur fitting into the acetabulum, and it can then rotate. Okay. So that then would be circumduction. It takes care of everything. There are only a few joints that can do that. My shoulder, I can do that. And my hip, I can do that. Nowhere else can I do that. Now, we will on the next unit find out which muscles actually do that move the skeleton to be able to then have that action. Now we have some additional movements. Okay. So the first one, these are having to do with your foot. So in anatomical position, my foot is flat. Okay, I'm standing erect, arms to the side. I can take and I can get my toes up toward the ceiling. When I bring it up, that's called dorsiflexion. So when I bring my toes up, that's dorsiflexion. When I bring it back to anatomical position, that's going to be it's going to be extension. And then when I stand on my toes, then that's going to be plantarflexion. So I'm just, here's my foot, flat, dorsiflexion, plantarflexion. Okay? All right. We also have inversion and eversion. So here's my foot. Okay, if I'm walking and my foot moves inward, the soles of my feet face inward, that's called inversion. If as I'm walking, my foot goes out like so, that's eversion. So people who in this class are runners and they've got special shoes, they've got soles that are going to help to maintain a straight foot when they have any kind of inversion or eversion of the foot when they're running. Okay. Okay. Again, supination, pronation, that has to do with the radius and the ulna. So which one is going to fold over or cross over the other? Which one is the stationary one?
Radius over the ulna.
The ulna is the stationary, and then the radius rotates, right? That's why the head of the radius rotates around the capitulum. That's what allows me to do this. That rotating, that little pivot is a fovea, and then I can go ahead and do that pronation and supination. Okay? When I take my hands, okay, they're in anatomical position. Now, let's talk about this. If I'm standing in anatomical position and my hands do this, okay? My fingers, my digits are doing this. That's flexion. Okay? I'm standing like this. They should be like this. I do that. Flexion. Extension. And yeah, I can do some hyperextension there. Okay? If I'm looking at abduction and adduction, abduction, that. Adduction, that. Okay? Again, anatomical position, that versus that. Right? So it's movement, it's away from that main area. So we've got those two, and then we can do opposition. That's where we have like opposable thumbs, right? So that you're able to use your pencil and pen, etc. Okay. All right. Another one is protraction and retraction. So protraction is bringing the mandible out, right? Okay, and then bringing it back to anatomical position is retraction. Protraction and retraction. If I take and I drop my lower jaw, that's called depression. Bring it back up, elevation. Elevation, depression. Right. Elevation, depression. Okay. So I have a number of different kinds of actions that we have that based upon the kinds of joints that are formed. So I'm not going to ask you to learn hinge joints or plane joints. Just going to forget those right now. Come back to those with muscle. Okay, saddle joints. Don't. All right, the only one I want you to know is ball and socket. So your arm The head of the humerus fits into the glenoid cavity. It's held in place by way of a capsule and 4 muscles, the rotator cuff, that hold them in position. So that allows you to then help in that circumduction. So you only have circumduction in ball and socket. Okay? So it's like a head fitting into a little groove. Same thing with my hip. The head of the femur is going to fit into the acetabulum, and then I'm going to have that circumduction at that hip joint. Okay. Let's go ahead and move on. Those I'm not going to. Okay, now, some inflammatory conditions of the joints. Just a little bit of pathology. Don't go into a lot. You'll get more clinical when you get to your programs. Okay, so the first one is bursitis. Anytime you see the suffix itis, appendicitis, right? That means it's an inflammation of whatever is in the word root. So in this case, bursitis, oh, it's inflammation of the bursa, okay? And so some people will have a bursitis, especially when they're doing repetitive action and they're having more pull on that ligament that may cross over that joint. So they're going to have then this bursitis. Another one would be carpal tunnel syndrome, which is a tendinitis. Okay? Inflammation of the sheath of bursa that we talked about. Okay, so that is also an inflammatory. If I stretch or tear my tendon or ligament, then that's going to be a sprain. Okay, so it's got a tendon sprain. Another clinical group of pathologies would be then arthritis. Okay. So in arthritis we have, again, arth refers to the joint. Itis is an inflammation of. Okay. So we have then osteoarthritis. In osteoarthritis, the cartilage is being eroded. Your articular cartilage, which is hyaline cartilage, now we've heard it multiple times, you've seen it on the little quiz, right? So we have then hyaline cartilage on the ends of bones, long bones, so that you can reduce the friction. Well, if you lose that over the course of time, it's an aging process, then bone has a greater probability of grinding on bone. Bone on bone hurts. So you're going to have, because they're highly innervated, so you're going to have a lot of bone destruction, and you're going to have a lot of pain associated with it. So you can see what's happening here. The cartilage, the hyaline cartilage is being eroded. Now we start getting bone to bone, and then we're going to get bone spurs. We're going to get bone chips as a result of that grinding. Okay? So oftentimes you got to go in there and you got to clean out that space. It's normal aging, but you can reduce it if you just, again, a lot of this you can go ahead and address by simply maintaining proper nutrition, exercise, sleep, all of those good factors that are associated with good health. Just maintain that, and you reduce the probability of the osteoarthritis. It does happen, but it's not as pronounced. Other individuals might have it sooner because they might have an underlying genetic issue that's associated with it too. You know what I'm saying? Sometimes it's an autoimmune disorder, slightly. Okay. So if you're over 85, most likely you're going to have some form of arthritis. Rheumatoid arthritis. So osteoarthritis, again, is just degradation of the hyaline cartilage, bone on bone. You get bone chips, and so you get inflammation and it hurts. But when you start attacking your own synovial membranes and the hyaline cartilage, etc., you're going to have then rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disorder. So you're attacking your synovial joint, okay? And so as a result of that, you're going to start having disfigurement. And you can do an easy screen for this. You can, they look for rheumatoid antigen, RA. You can check it in the blood. If you start having these various kinds of anomalies and pain associated then with your joints, they can run a very routine RA test and tell you if you've got any onset of rheumatoid arthritis. So it's something you can address early on, and you can then take some precautions. For some people, it could be that you're going to now block your immune system. Or there are some things that, like some people will have pain associated with rheumatoid arthritis if they eat certain kinds of food, like chocolate maybe, okay? Sometimes some people are, and you don't realize it, but then you, over the course of time, begin to have an autoimmune disorder associated with then the allergen coming in. Okay? Another one would be then gouty arthritis, and this is one usually associated with the foot, and it's usually associated with people who eat way too much protein, and their kidneys are overwhelmed by the amount of protein coming in. So they lodge in predominantly in the feet, and so you're going to have this uric acid crystals. That's from protein metabolism. Uric acid, as you can see, it's got ammonia in it, so you've got then the breakdown of that, and you start having the accumulation in the joints. So again, there are medications that you can take, but if that's the initiation, you cut back on your proteins, right? You can at least address some of it by way of health. Okay, so that then is all the information for this next exam, right? So we've got everything completed, and the book does a really good job in describing all of this, so